So with the self-assessment, we start off with posterior and anterior pelvic tilts. So here I am in posterior, now anterior. Posterior is when we tilt the pelvis backwards, anterior is when it tilts forwards. Often a lot of us can find it hard to tilt posterior, so common mistakes are bending of the knees, arching the back. So ideally we just want the movement coming directly from the pelvis and not from anywhere else. So knees locked out and just having the pelvis moving. Pelvis shift, so just seeing if we can actually shift our pelvis to the side. Seeing how that feels. Does it feel easy? Is it easier one side than the other? Just take note of that. Same with with everything throughout this. Just take note if one side feels easier than the other. So hip hikes. So we're bending one knee and letting the hip drop, resulting in a hike on the opposite side. So some common mistakes with the hip hike. When we bend the knee, we fall to the side. Bending the spine towards the hike tip. So again, just nice, smooth flowing. Just take note, is one side easier to hike than the other? Can you hike at all? Pelvis rotation. So for this, we want to keep the chest locked in position, straight forward, and have the pelvis just rotate to the side. So just a nice, easy transition to the side. Take note, is it easier to go to the right or the left? Some common mistakes are rotating the whole body. So as you can see, my chest is also moving with my pelvis. Actually shifting the pelvis instead of rotating it. So again, just a nice, smooth movement each side. Take note of which is easier. So the spine side bend. Here we're looking to bend the spine from the middle of the spine, okay? So just above our belly button, we're looking to bend from there. We don't want the bend to come from our lower spine or upper spine, okay? So just a nice smooth movement, okay? As if there's a pane of glass either side and you're trying to side bend your spine within that pane of glass, okay? Some common mistakes with the side bend involve side bending from the lumbar spine, so your lower back. So as I said, if we're to have a pane of glass either side of us, we'd be hitting into the pane of glass. So we don't want that. We want to rotate from the lumbar spine. Using our shoulders to drive the side bend. So as you can see here, my shoulder drives up, which causes the side bend. So often if we're unable to actually side bend, we will use our shoulders or compensate elsewhere to help with the motion. So just we want a nice smooth side bend as if there's two panes of glass either side. So with the spine side bend, we want the movement coming just from the spine. So we want the hips, the pelvis locked in, straight forward, no movement. The movement comes solely from the spine. So our hands are on our chest and we just rotate to the left as far as we can and then to the right as far as we can. Take note, is it easier to go to the right or to the left? Do I have more range of motion going one side than the other? Any pain or discomfort going one side compared to the other? Some common mistakes with the side bend is not keeping the pelvis locked in place. So your pelvis actually moves with the spine. So obviously you'll get more rotation. Using the shoulders and arms to actually drive the movement more. So again, we're compensating because we lack movement in the spine. So we use the shoulders to drive the movement. So just a nice, smooth movement. So next, side flexion. So here we're just looking to see how our neck moves either side, to the left and to the right. So we're rotating around the nose, so having the nose as the center focal point and side bending to the left and to the right. Just take a note, am I restricted on one side compared to the other or both sides? Some common mistakes are side bending, driving the shoulders up. So the movement isn't coming from the cervical spine, it's actually movement is coming from elsewhere in the spine, usually the lumbar spine or mid spine. So just a nice fluid movement, left and right. Take note which is easier. So neck rotation. Here we're just rotating our head to the left and then to the right. So again, just taking note how it feels moving to the left, moving to the right. We want the movement coming just from the neck, so the cervical spine. We don't want any rotation elsewhere in the body. So just some common mistakes. As I mentioned, you can see here rotation coming from elsewhere, so coming from the rest of my body. So we don't want to involve the arms, the rest of the spine or the hips. We just want to look straight forward, everything locked in place and moving the head to the left and to the right. So with the shoulder mobility, what we're looking for here is to see how well our shoulders actually rotate. A lot of the time with the ball and socket joints, such as the shoulder and the hip, we don't actually get a full proper rotation in these joints. So as you can see here, I'm just kneeling down. We can do the standing up also. So I'm just getting a full rotation in my shoulder joint. So here I'm just reversing the motion now, bringing the hand back. I start to rotate, keep rotating, keep rotating. You'll feel this in the shoulder joint, shoulder socket. So as I'm at the start position now again, I bring the arm straight up as far back as I can, out the side as I start to rotate, really feeling the movement in the shoulder joint, and up by my hip. I work backwards again as far as I can, really pushing the boundary as far back as we can the whole time throughout the movement. So just a side view here. So straight up as far as we can. When we get it back as far as we can, that's when we start to move our shoulder arm to the side and start the rotation. So as you can see, my hand is just rotating, and it finishes up with my palm facing away from me. As I work back through the movement, my palm starts to rotate again. So just take a note of how the actual rotation feels. If you have any restrictions anywhere, any discomfort anywhere, just take note. Compare it to the other shoulder as well. So some common mistakes involve rotating our body to the side. So often when we're restricted in shoulder mobility, our body will look for the movement elsewhere, usually the spine. So as you can see here, I'm side bending my spine to allow the movement to happen, or else I will rotate my spine to allow the movement to happen. Both are very common. Not actually rotating the arm. So as you can see here, I'm not actually getting a proper rotation in the shoulder joint. And again, side bending the spine. So just take note of what you can and can't do and compare both shoulders. Ankle mobility. So with this one, we want to bring our knee as close to the wall without our heel lifting. So as you can see here, my heel lifts off the ground, so this is too much for me, so I have to bring my foot closer. So as you can see here, my knee is touching the wall and my foot is flat on the ground. When you get this position, you can move your foot back slightly and bring the knee into the wall again to see if the foot can remain on the ground. So we're just trying to find our limit before the heel actually rises off the ground. So again, just take note of how it feels, what your range of motion is in both feet, and any restrictions.